to the features of the anterior cranial fossa. This anterior cranial fossa in the midline is related to the crest of the frontal bone articulating with the perpendicular plate of the ethmoid bone. This perpendicular plate of the ethmoid bone consists of crista galli and cribriform plate on either side laterally. This crista galli gives attachment to the anterior end of the falx cerebri, whereas this cribriform plate is pierced by multiple foramens. And on laterally it is related to the frontal lobe. Now coming to the middle cranial fossa, where it lodges the pituitary gland in sella turcica. This sella turcica is made up of tuberculum sellae, hypophyseal fossa and dorsum sellae, and on laterally it is related to the temporal lobe. Now coming to the posterior cranial fossa. This posterior cranial this is the clivus. Here it is formed by the articulation of body of the sphenoid and the basilar part of the occiput. Here it is related to the medulla oblongata and pons. This big foramen is the foramen magnum, where it is related to the spinal cord and vertebral artery, and on laterally here it is related to the occipital lobe. This midline structure is the occipital crest and occipital protuberance. Here it gives attachment to the tentorium cerebelli, and lateral to the occipital protuberance is the transverse sulci, where transverse sinus runs. This transverse sinus joins the sigmoid sinus, and the sigmoid sinus drains into the jugular vein.